So in order to check the reliability of the AI algorithm, one of the questions that we asked is, what is the utility of the Ibex algorithm in the diagnostic workflow of prostate biopsies? This question was asked in a large network of pathology laboratories in the south of France called Medipath. The study was comprised of 100 patients who were initially diagnosed as not having cancer. In these 100 patients, they often get multiple biopsies, and so the study set comprised of 800 slides. The study was set up and the instrument and algorithm was calibrated in such a way that the sensitivity of detection of cancer was 97% and the specificity once identified was 99%. In the study, 15 patients who were initially diagnosed as being benign were flagged off as having been suspicious for cancer. So the study comprised of 25 slides from these 15 patients that were then subject to further expert review. The study found that 12% of the patients, or 12 patients who were diagnosed as not having cancer, were actually had cancer as confirmed by one of two experts, and I had the opportunity and privilege to review these slides. In the 12 patients who were initially diagnosed as being benign, when we go back and look at which were the cases that were missed, the misses spanned a spectrum and a gamut of pathology. While as expected, there was some small foci of cancer that was missed, very interestingly and unexpectedly, we found that foci larger than 3 millimeters were sometimes missed, and there were higher grade cancers, Gleason score 4+3, that were also missed in the study. So my overall impression was that I would have expected that the pathologists who may not have the experience or who have high volume of cases to look at may miss small foci of cancer. But what was interesting to find is that there were some cases that were larger volume or of higher grade cancer. So my take-home message from this study is that AI is a perfect companion for pathologists who are looking at a lot of diagnostic material or may not have the expertise to look at this material with that level of confidence. The ability for AI to not only detect small foci of cancer that can be missed by pathologists is a validation of its value, but more interestingly and importantly, higher grade cancers that may be very small or sometimes higher volumes of cancer that may be missed because of deceptive aspects in pathology are an important contribution to where AI can help. Most importantly, this is a 100% prospective quality assurance that the pathology department, the pathologist, and the patient gets when AI is employed with competent diagnostic pathology.